Welcome to UMCC Medical Consultant Connectors, where your health matters to us. Ever had that nagging curiosity about what a clavicle fracture is? Well, let's unravel this mystery together. A clavicle fracture, also known as a broken collarbone, is a common injury typically caused by a fall or direct impact. The clavicle, or collarbone, is a critical part of your body's framework. It links the upper limb to the trunk, acting as a strut to keep the shoulder in place. So, as you might guess, a fracture can be pretty serious, but what exactly causes it? Clavicle fractures don't just happen. They're usually the result of some specific circumstances. The main culprits? Falls, sports injuries, and car accidents. Let's dive a little deeper. When we talk about falls, we're not just referring to tripping over a toy in the hallway. We're talking about high-impact falls, like falling off a ladder or taking a nasty spill on a bicycle. In these situations, the force exerted on the shoulder can be enough to fracture the clavicle, the bone that acts as a strut between the shoulder blade and the breastbone. Sports injuries are another common cause. Contact sports like rugby or football, where there's a high chance of direct impact to the shoulder, often result in clavicle fractures. And then we have car accidents. The abrupt force exerted during a collision can easily break this relatively slender bone. Now that we know the causes, what are the signs that you might have a clavicle fracture? Clavicle fractures are painful, but there's more to the picture than just that. When your clavicle or collarbone fractures, it's not just pain that signals trouble. You might notice swelling in the area, or perhaps the skin around your collarbone has turned an alarming shade of blue or purple, indicating bruising. Don't be surprised if you find it difficult to move your arm, or if you experience a grinding sensation when you do attempt to lift it. Now, it's important to remember that not all clavicle fractures are created equal. A minor fracture might result in a dull ache, while a severe break can cause sharp, intense pain. The severity of other symptoms, like swelling and bruising, can also vary. And here's a telltale sign. You might see a bump or deformity where the bone has broken. This is your body's way of telling you something's not quite right. Detecting a clavicle fracture is not always straightforward, but understanding these signs can make a significant difference. If you suspect a clavicle fracture, prompt diagnosis and treatment are crucial. So, how do doctors typically diagnose this type of fracture? The first step is usually a physical exam. The doctor will look for signs like swelling, tenderness, or bruising over the collarbone area. They'll also check for any deformities, which could indicate a fracture. Next comes imaging tests. An X-ray is the most common method used to confirm a clavicle fracture. It provides a clear picture of the bone and helps identify the location and severity of the fracture. In some cases, a CT scan may be performed to get a more detailed view, especially if the fracture is complex or involves the joint. Now let's talk about treatment. The goal is to manage pain, heal the fracture, and restore function. For most fractures, the treatment is non-surgical. The arm is immobilized using a simple arm sling to keep the bone in position while it heals. Pain is managed with over-the-counter pain relievers or prescription medication, if required. However, severe fractures may require surgery. This usually involves the placement of plates, screws, or pins to hold the bone fragments in place. Following the surgery or non-surgical treatment, physical therapy is often needed to regain strength and mobility in the shoulder. With proper treatment, most people recover fully, but wouldn't it be better if we could avoid these injuries in the first place? Prevention is the best medicine, as they say. When it comes to clavicle fractures, one of the most effective preventive measures is wearing protective gear during sports. This is especially crucial in high-impact sports or activities that expose the shoulder to potential injury. But prevention doesn't stop at the playing field. Simple daily precautions can also make a big difference. This includes things like keeping your living areas free of clutter to avoid falls and being extra careful when walking on slippery surfaces. Equally important is nurturing your bone health. Consuming a balanced diet rich in calcium and vitamin D can go a long way in strengthening your bones. Regular weight-bearing exercises, such as walking or lifting weights, can also help in maintaining bone density. Remember, your clavicle plays a critical role in your body's function, so take good care of it. Your health is worth it. UMCC, your ultimate medical consultant connector.